So today I'm discussing one of the drug classes that act upon the renal system. Now, under this we have the vasopressin V2 receptor antagonists. So these are drugs that act upon the kidneys to block the effects of the antidiuretic hormone or the vasopressin, leading to an increased water excretion without significant electrolyte loss. So one of the drugs under this drug class is the tolvaptan. Now, tolvaptan is a second generation selective vasopressin V2 receptor antagonist used to treat hyponatremia, heart failure, autosomal dominant polycystic kidney disease, or ADPKD, and it works by inhibiting the V2 receptors in the renal collecting ducts, preventing water reabsorption and promoting free water excretion. Now, common adverse effects include polyuria, thirsty and dry mouth, and then hypotension. Moving forward, the IUPAC name of this specific drug is N4 7-chloro 5-hydroxy 2,3,4,5 tetrahydro 1-benzazepine 1-carbonyl 3-methylphenyl 2-methylbenzamide. Now, you'll notice that the structure is on the right. So the structure of this specific drug molecule is on the right. And you'll also notice that below the IUPAC, we have the structure activity relationship. So the structure activity relationship is incredibly important in order for us to understand how the drug's biologic activity is based on the structure, you know? So, first of all, we will start with the benzazepine core, which is the central scaffold. So, you'll notice that this red that it's encircling, is the benzazepine core. Now, the benzazepine core is a seven-membered azepine fused to a benzene ring, is essential for the binding of the vasopressin V2 receptor, V2R. So this core provides the correct three-dimensional conformation necessary for receptor interaction. Now, it provides a very high selectivity for the V2 receptor over the V1 receptor, reducing vasoconstructive effects. Now, this is also very important because it forms the backbone of the V2 receptor binding. Now, you'll notice the one here with a pulsing circle is that you'll notice the benzene ring and the seven-membered ring being fused together. Now, again, that is our benzazepine core, which is technically very important for binding of the V2 receptor. So, high selectivity for the V2 receptor. Moving forward, we have the hydroxylated benzophenone moiety, which is important for the hydrophobic and the hydrogen bonding. Now, the benzophenone or the diphenyl ketone, so you'll notice the ketone over here near this double bond, and we'll also see the diphenyl, which is a group that enhances hydrophobic interactions with the receptor. Now, um, this group enhances hydrophobic interactions with the receptor. The hydroxyl or the OH group over there, you'll notice, is a group at the para position which contributes to the hydrogen bonding, improving binding affinity. Now, again, this is very important for us to bind to the correct receptor. Next, we have is the toluene methylphenyl group, which is important for the hydrophobic interaction. So the methylphenyl group or the hydrophobic interaction, the petolyl paramethyl Phenyl group enhances lipophilicity, which improves membrane permeability. It also stabilizes binding via the hydrophobic interactions with the receptor pocket. Now, again, this is important because it enhances lipophilicity, which increases membrane permeability. And, it's incredibly important because specific drug molecules or this drug in specific needs to permeate the membrane, needs to enter the membrane in order to take in order for the reaction to take place, in order for its therapeutic effect to take effect. So technically, that is it. And next, lastly, we have the amide bond, which is key for the binding stability. Now, the amide bond, you'll notice over here on the lower part, for binding stability, the amide, which is our CONH, is the linkage that improves receptor selectivity and enhances drug stability. It contributes to the additional hydrogen bonding interactions. So you'll notice that again, it forms hydrogen bonds with the V2 receptor. So it contributes to a strong binding affinity. Again, we have to reiterate how binding is incredibly important, and replacing or removing this group reduces the receptor binding, which is not what we want our drug molecule to bind to the receptor in order for it to take its therapeutic effect. Now, moving forward, in the next slide you will see the references that were used in this specific topic, in this specific V2 receptor topic. And thank you. That's all. This is Aiko.
Next is we have another drug that acts on the renal system, and this is the angiotensin II receptor blockers or ARBs, specifically the losartan. So angiotensin II receptor blockers or ARBs like losartan are designed to selectively block the angiotensin II type 1 or AT1 receptor, preventing vasoconstriction and aldosterone release, which helps in reducing blood pressure, which increases urine output and increases the excretion of sodium, potassium chloride, magnesium, uric acid, calcium, and phosphate in urine. Losartan is a first-generation angiotensin II receptor blocker or ARB. It was the first ARB developed and approved for clinical use. Losartan is the first-line treatment for hypertension. It is a treatment for chronic kidney disease and diabetes as it slows kidney damage and diabetic nephropathy. It is also used as treatment for heart failure in patients intolerant to ACE inhibitors. So it also has its common adverse effects. So dizziness or hypotension due to the vasodilation and reduced blood pressure, hyperkalemia, which is an increase in potassium levels due to decreased aldosterone secretion. It also can cause fatigue, which is possibly due to the reduced blood flow and blood pressure changes. Before moving on to the losartan SAR breakdown, let's first talk about its mode of action. So losartan again is an angiotensin II receptor blocker that selectively blocks the AT1 receptor. So by doing so, it prevents angiotensin II from binding and exerting its effects. By inhibiting the AT1 receptor, losartan causes vasodilation, reduces aldosterone release, and decreases fluid retention, which leads to lower blood pressure and reduced strain in the heart. So additionally, it helps protect the kidneys in diabetic nephropathy and prevents cardiac remodeling in patients with hypertension and heart failure. Losartan has the IUPAC name of 2-butyl-5-chloro-3-4-2-2-H-tetrazole 5-il-phenyl, phenylmethyl, imidazole 4-il-methanol. Here we have the structure of losartan. So let's do the SAR breakdown of ARBs using losartan as an example. So we have the biphenyl tetrazole or carboxylate group. So tetrazole or carboxylate group is crucial for strong hydrogen bonding to the AT1 receptor. In losartan, this tetrazole ring enhances stability and absorption. Next is we have the imidazole or other heterocyclic rings. So it mimics the histidine residue and angiotensin II, helping in receptor interaction. This is present in losartan and its metabolites, contributing to potent AT1 receptor blockade. So next is we also have the lipophilic biphenyl moiety. So this hydrophobic region increases binding affinity to the AT1 receptor. It also improves membrane permeability and helps in oral bioavailability. It also has its metabolically active groups. So losartan is a prodrug. So it is converted in the liver to a more potent carboxylic acid metabolite, which is the EXP3174. This metabolite has a 10 to 40 times greater affinity to AT1 receptors than losartan itself.
Diuretics. Diuretics increase urine output by acting on different parts of the nephron. Thiazide diuretics, such as hydrochlorothiazide, act on the distal convoluted tubule of the kidney. They inhibit the sodium or chloride symporter, leading to increased sodium, chloride, and water excretion. This results in diuresis and blood pressure reduction. Hydrochlorothiazide is a first generation thiazide diuretic. It has been used to treat high blood pressure or hypertension and fluid retention or edema for over 60 years. It's a common and generally safe medication, but like any drug, it has potential side effects. Hydrochlorothiazide is primarily used for hypertension. It helps lower blood pressure by increasing urine output and reducing fluid volume in the body. And it is used for edema. It helps reduce swelling caused by conditions like heart failure, liver disease, and kidney disease. Common adverse effects. While generally well tolerated, the most common adverse effects of hydrochlorothiazide include hypokalemia or low potassium levels. This can lead to muscle weakness, fatigue, and irregular heartbeat. Second is hyponatremia or low sodium levels. This can cause confusion, headache, and seizures in severe cases. And the third is dehydration. This can lead to dizziness, lightheadedness, and constipation. Note, these are just the most common side effects. It's important to consult with a healthcare professional for personalized advice and to report any unusual symptoms. Mechanism of action. Hydrochlorothiazide is a thiazide diuretic which acts by inhibiting sodium reabsorption in the distal tubules, thereby causing increased excretion of sodium, potassium, hydrogen ions, and water. The hypertensive effects are initially due to volume reduction, but the persisting effect includes other undetermined mechanisms to reduce peripheral resistance. So here is the example, thiazide and thiazide-like diuretics. Example here is the hydrochlorothiazide. IUPAC name is 6-chloro 1 dioxo 4-dihydro 2H 1 lambda 6 2 4 benzothiazine 7 sulfonamide. So here is the structure of the hydrochlorothiazide. SAR breakdown of thiazide diuretics using hydrochlorothiazide as an example. First is benzothiazine ring system, crucial for diuretic activity, forming the core structure. Modifications to this ring affect solubility and receptor binding. Second is sulfonamide, sulfonamide group. It is essential for binding to the sodium or chloride symporter or NCC in the distal tubule, and removal or modification of this group significantly reduces diuretic activity. The third is electron withdrawing group or EWG at position 6. It is usually chlorine or trifluoromethyl or CF3 group. It increases diuretic potency by enhancing receptor affinity. Example, hydrochlorothiazide has chlorine at position 6, which improves activity. The fourth is saturation at position 3, 4, increases potency and duration of action. Example, hydrochlorothiazide saturated is 10 times more potent than chlorothiazide unsaturated. Fifth is the lipophilic substituent at position 3. Alters tendency, duration, and lipid solubility. Example, adding a methyl or CH3 or alkyl group increases lipophilicity, affecting the half-life.
I will be discussing about one of the drugs acting on the renal system, such as furosemide. So, what is furosemide and what is it used for? Furosemide is a first-generation loop diuretics used to treat hypertension and edema caused by congestive heart failure, cirrhosis, and kidney disease like nephrotic syndrome and CKD or chronic kidney disease. It is a high-ceiling diuretics, meaning it produces a strong diuretic effects. So how does furosemide works? Let's go to the mechanism of action. So before using furosemide, the NKCC2 importers in the thick ascending limb of the loop of Henle actively reabsorbs sodium, potassium, and chloride in ions from the urine back into the bloodstream. This process helps the kidney retain water, maintain blood pressure, and regulate electrolyte balance. Since water follows sodium, fluid retention occurs, which is necessary for normal circulation but can lead to edema and hypertension in certain conditions like heart failure and kidney disease. So, when you take furosemide, it inhibits the NKCC2 importer in the thick ascending limb of the loop of Henle, preventing the sodium, potassium, chloride, and chloride reabsorption. Since water follows these ions, their loss leads to increased urine output, reduced blood volume, and lower blood pressure. The loop of Henle is responsible for maintaining the kidney's ability to concentrate urine. By blocking NKCC2 importers, furosemide disrupts this process, resulting in rapid and significant uresis. This makes it highly effective in conditions where excess fluid accumulate is a problem, such as heart failure and kidney disease. So, so let's move on to the structure-activity relationship of furosemide. There are four groups consisting in the structure of furosemide. First is sulfonamide group, carboxyl group, aromatic ring, and amine group. First is sulfonamide or the SO2 and H2 group. This is essential for binding to NKCC2 importers in the loop of Henle. It inhibits potassium, sodium, and chloride reabsorption, leading to diuretics. So meaning, this group is essential for binding to NKCC2, ensuring the drug's ability to inhibit sodium, potassium, and chlorine reabsorption. The sulfonamide enhances diuretic effect, activity, and modification to this group generally lead to a loss of function. It is associated with allergic reaction, as sulfonamide can cause hypersensitivity in some patients. The second group is the carboxyl group or the COOH group. This group increases water solubility and contributes to plasma protein binding, which helps deliver furosemide to its site of action. So meaning the carboxyl group increases water solubility, allowing better absorption and distribution in the body. It facilitates plasma protein binding, which prolongs the drug's action by controlling its release. It also plays a role in renal excretion, ensuring the drug is efficiently eliminated from the body to prevent prolonged effects or toxicity. The third group in the structure is the aromatic ring. The fused benzene and furan ring enhances lipophilicity, allowing furosemide to penetrate cell membrane more efficiently and bind to NKCC2 importers. These structures is crucial for drug receptor interaction, improving potency of diuretic action. The fourth group is the amine group, which is the NH in the structure. The amine group improves solubility and ensures the drug remains stable under physiological conditions. And chemical modification at this site can alter the drug's potency and bioavailability, affecting how quickly it acts and how long it stays in the system. Let's move on to the adverse effect. The most common adverse effect is electrolyte imbalances such as hypokalemia, hyponatremia, hypocalcemia, and hypomagnesemia. Since furosemide prevents sodium, potassium chloride, calcium, and magnesium reabsorption, excessive loss of these ions occurs in the urine. The hypokalemia or low in potassium can lead to muscle weakness, arrhythmias, and fatigue. Hyponatremia or low in sodium affects nerve function and can cause confusion, seizure, or even coma in severe cases. On the other hand, hypocalcemia or low in calcium and hypomagnesemia or low in magnesium can contribute to muscle cramps, osteoporosis, and neurological symptoms. The other common common adverse effect is dehydration. Since furosemide can lead to massive water loss, it can cause dehydration if fluid intake is not properly managed. Dehydration can result in low blood pressure, dizziness, and kidney damage due to reduced perfusion. The third common adverse effect is dizziness. The rapid loss of fluid reduces blood volume, leading to low blood pressure, and this increase in circulation and can cause dizziness, especially when standing up quickly. Since furosemide is highly potent, its side effects are primarily due to excessive loss of electrolytes and water. While effective, it requires careful monitoring of fluids and electrolyte balance to prevent complications. So that will be all from my topic. Thank you.
ACE inhibitors or angiotensin converting enzyme inhibitors. Like enalapril, work by inhibiting the ACE enzyme, preventing the conversion of angiotensin 1 to angiotensin 2, a potent vasoconstrictor. This leads to vasodilation, reduced blood pressure, and decreased workload on the heart. Enalapril reduces blood pressure, which helps protect the kidneys from damage. So the generation of enalapril or enal, it is an enalapril prodrug belonging to the first generation dicarboxylate containing ACE inhibitors. So the indication of enalapril is used to treat hypertension, lower blood pressure, heart failure, improves heart function, left ventricular dysfunction, prevents heart disease worsening, diabetic nephropathy is protects kidney, and the adverse effects of enalapril is hypotension, low blood pressure, cough, hyperkalemia, high potassium levels. So, mechanism of action of enalapril is the active form of enalapril is enalapril, which inhibits the ACE, thereby reducing the level of angiotensin 2. These actions leads to a decrease in total peripheral resistance without an increase in cardiac oxygen demand. Consequently, a decrease in aldosterone and an increase in serum renin levels are observed. So, example is enalapril. The UPAC name is 2S1, 2S2, 2S1 etoxy, 1-oxo-4-phenylbutan, 2L-amino-propanoyl pyrrolidine, 2-carboxylic acid. So this is the structure of enalapril. So these are the carboxyl COH group, which is essential for ACE inhibition. And this is the pyrrolidine-like ring. Pyrrolidine is helps the drugs bind to ACE, and this is the ester COR group. Makes enalapril a prodrugs for better absorption, And the last is the phenyl group aromatic ring, which is improves the drug solubility and binding. So the SAR breakdown of ACE inhibitors using enalapril as an example. So first is dipeptide structure or proline base. Is ACE inhibitors are designed to mimic angiotensin 1, the natural substrate for ACE. The proline residue is crucial for high affinity to the ACE active sites. M2 is the ester group, which is COOCH2CH3 in enalapril. So enalapril is a prodrug and has a ethyl ester group to increase lipophilicity and oral absorption. In the body, it is hydrolyzed to enalaprilat, the active form. 3 is carboxyl, which is COO or phosphonate POO group. Is essential for binding to the zinc ion at the ACE active sites. So this is the main functional group responsible for enzyme inhibition, and enalapril is the most ACE inhibitors use carboxyl, while fosinopril uses phosphonate, which enhances zinc binding. 4 is proline or similar heterocyclic ring. This mimics the C-terminal amino acids in angiotensin 1. It helps improve binding and selectivity for ACE.